A new report is shedding light on the work of private consultants during the pandemic. The Washington Post analyzed the efforts of several private firms that were paid millions by states and federal agencies to take charge of the vaccine rollout. Critics say this only hindered vaccination efforts, building concern over how a future health crisis could be handled. Isaac Stanley-Becker wrote that report and joins me now. He's a national political reporter for the Washington Post. Isaac, thanks for being with us. Tell us more about what these vaccine consultants were paid to do.
Thanks for having me. It really ran the gamut. It was everything from data analysis to technology support to assistance with really vexed considerations about vaccine allocation, vaccine eligibility. I think we all remember how chaotic and difficult those months were, especially, say, December through February. And what I found through hundreds of pages of email correspondence, contract documents, is that consultants, and not always consultants with public health backgrounds or experience, were playing a really large role in making some of these decisions, executing, planning, and organizing officials in stressed and difficult moments.
Well, how many states actually use these consultants to help with vaccine rollouts?
It was a lot. It was at least 25 by my tally, based on interviews and public records that I obtained. And that's specifically management consultants. So that doesn't account for other types of private sector partnerships, just say purchasing technology or other sorts of arrangements. These were the states that actually hired, private management consultants from these firms to come in and assist here. And I should also say that it was not just states. In addition to these 25 states, or at least 25, there were also federal agencies, cities, counties, other public institutions.
Your piece was so eye-opening and intriguing with sort of this comparison. Tell us more about the states that did not use vaccine consultants. What did they do differently and how did they fare?
This is a really important point, because what we don't have is a counterfactual in the states that used consultants. We don't know necessarily how they would have fared had they not, done these expensive contracts with private firms. What we do know is that there are a set of states that have done quite well. And these are largely states that did not rely on consulting firms. So Vermont, for instance, the first state that delivered at least one dose to 80% of eligible residents, did not. Colorado, the state doing best in the Rocky Mountains, did not. New Mexico, the state that's doing best in the Southwest, did not. Now, of course, comparisons can be difficult. Vermont is a very small state. Some of these are states that have healthier populations. But in terms of the management of this campaign, which had certain similarities state to state, no matter the size or the nature of the population, I still think that that's an elucidating comparison.
Absolutely. And what are some of the major concerns that current and former health officials have about relying on consultants now and in the future?
There are a range of concerns, and I would put them in two categories almost. One is the in-the-moment concerns about the effectiveness of some of these consultants. And in certain states, I found that those concerns were quite acute. In California, for instance, where private contractors played a really large role, I spoke to health officials both at the state and the county level who questioned the effectiveness and the ability of these consultants, and said in cases they added very little, and in certain cases they actually had a deleterious effect in terms of the speed and effectiveness of some of these decisions. In other cases where what I heard from officials is largely that the consultants did help, given the magnitude of the work, given the pace of this, the complexity of it, the concern is a bit different, and it has to do with the nature of our government and our public institutions and their effectiveness and their capacity. So we know this isn't going to be the last threat of this kind. There are other, viral threats. Experts think we will have, another pandemic, could be even worse than this one. And the question is, will we be prepared? Have we learned the proper lessons from this pandemic? Do we have a sustainable public health workforce that's trained and equipped year to year, not just for a 6-month stint, but year over year to respond, learn these lessons, improve. And that's really the larger question about how we want our government to work. Do we want it to be, based on skilled, trained, full-time public servants accountable to taxpayers, or these consultants who are brought in for short-term stints and then leave after that period?
Really, really important questions. Isaac Stanley-Becker, thank you so much for joining us, Isaac.
Thank you.
A special immigration process is helping some at-risk